Hello folks, I am Prithvi Inukonda, MSW student in the Department of Social Work at Rajiv Gandhi National Institute of Youth Development. Today here we shall learn about the relevance of crisis intervention model in social work practice. Albert R. Roberts and Alan J. Ottens are the pioneers of crisis intervention. They describe crisis as an acute psychological disruption during which a person's coping mechanisms fail, resulting in distress and functional impairment. A crisis intervention social worker's main focus is to provide support and guidance to clients in a state of acute mental health crisis. The problems are brought on by recent trauma or long-term case of post-traumatic stress disorder like natural disaster, severe physical injury, loss of loved ones, transitions like violence, war, etc. Crisis intervention plays a vital role in helping individuals who are at imminent risk of harming themselves or others. The tactics and techniques used by a crisis intervention social worker can have a significant impact on their clients' lives. One of the key roles of social worker for a crisis intervention therapy is the ability to elevate the affected person's distress, impairment and instability while being careful to avoid any actions that could worsen the crisis. Robert's 7-stage model for crisis intervention is being discussed here. Plan and conduct a thorough biopsychosocial and lethality imminent danger assessment. Begin with a fast and thorough biopsychosocial assessment. You want to find out what the supporters and stresses are, any medical issues, medications, any current substance use and coping strategies and resources. If there is concern about suicidality, you want to find out what the thoughts are. If there is intent and the strength of the intent, whether there is a plan and if the plan is potentially lethal, any history of past attempts and other specific risk factors, substance abuse, social isolation, losses such as divorce or employment. Make psychological contact and rapidly establish the collaborative relationship. In a crisis, you must do this quickly and it will ideally help as part of your assessment. Here we hearken to Roger's warmth, genuineness and empathy. These three skills will go a long way in developing rapport with your client in crisis. Identify the major problems including crisis precipitants. Find out from the client why things have come to a head. There is usually a so-called last straw, but you also want to find out what other problems the client is concerned about. It can be useful to prioritize the problems in terms of which problems the client wants to work on first. Encourage an exploration of feelings and emotions. Validate. You want to let the client vent about his or her feelings about the crisis. This is achieved using active listening skills like paraphrasing, reflective listening and probing questions. You can also challenge maladaptive beliefs. Generate and explore alternatives and coping strategies. This is where you come up with the plan. The clinician and the client ideally begin to come up with options that will help improve the current situation. You brainstorm about possibilities or ask about what has been helpful in the past as ways to get the client's input. Restore functioning through implementation and developing action plan. This is where you shift from a crisis to a resolution. The client and work will begin to take the steps negotiated in the previous stage. This is also where the client will begin to make meaning of the crisis event. Plan follow-up and booster sessions. The follow-up can be on many forms. A post-crisis evaluation may look at the client's current functioning and assess the client's progress and satisfaction with treatment. It can also involve phone or in-person visits at specific intervals. Once the immediate dangers to the client's well-being have been addressed, a working alliance is built with the client. If the client is suicidal, they may need to be able to persuade them that help is both available and worthwhile. This could involve mutually agreeing with the client on short-term goals and tasks and suggesting alternative coping methods that leverage the client's strengths. As Roberts and Ortens explain, some clients are in crisis, making one last heroic effort to seek help and may be highly motivated to try something different. Thank you so much, friends. This is the end of the topic. Thank you.